So glad you're here with us today. My name is Adam Franchella, and I'm the Chief Product Officer at Auggie. And I'll be guiding us through today's conversation about feeding transitions. And whether you're just starting to think about solid foods or knee deep in mashed bananas and bibs, like I am actually at the moment, then this event is for you. So excited to dive in. We all know that feeding can feel like a high stakes moment oftentimes, and there's pressure kind of coming from all directions, other family members, friends, social media, and even just kind of like your own expectations of the moment. But today we want to bring everything back to your baby and your instincts and what feels right for your family. And we are very lucky and thrilled to have a fantastic group of experts with us today. We have Dr. Anand Rajani, Chief Medical Advisor at Woddle and Neonatologist, at Stanford University. We have Bethe Levin, founder and CEO of Globowl. And we have Emily Silver, family nurse practitioner and international board certified lactation consultant and the co-founder at NAPS. So guys, I'll just start by passing it over to each one of you to just introduce yourself a little bit, a little bit more thoroughly. Erica, just you're my top left, so I'll start with you.
Okay, I'm on my top left too. Hi, everybody. My name is Erica Bethe Levin. I am the founder of Globowl. This is my third company. I've always been in the food business as a food writer and many other things. And I'm a mom of two. And so I started this company with my second child as a way to help prevent picky eating and food allergies, and all during a time when we couldn't leave the house. I have a quarantine baby. And so I wanted to be able to bring the world to my child during a time where we couldn't. And so eating the way people eat all over the world, I was excited, to kind of bring that back to America, feeding kids what it is that we're eating, and letting them really enjoy and even play, with their food. So yeah, thank you so much for having me.
Awesome. Emily, you're next up on the top right for me. So go to you next.
All right. Hi, everyone. I'm so happy to be here. My name is Emily Silver. As Adam said, I'm a family nurse practitioner. I'm also an IBCLC. And through my work at NAPS, I provide care, support, and education to families who are expecting a baby all the way through the baby years into the toddler years, which involves a lot of different ways of feeding, from getting started with breastfeeding to pumping, introducing formula, combo feeding, and then navigating the feeding space as we then introduce solids and then get into our picky eaters. So I really see an array of things. I'm also a mom. I have three girls, and they are 9, 8, and 3. And so I have learned a lot from them as well.
Amazing. All right. Well, Dr. Rajani, you want to go next?
Pleasure to be here and wonderful to meet all of you. So I'm Anand Rajani. I'm a neonatologist. I'm a board certified pediatrician as well. And I run a neonatal ICU and am the chief medical officer of Woddle. And Woddle is a integrated, smart, baby changing station scale tool for parents to help track growth and a number of other things that go on with our little ones. So happy to be here and excited to share what I know and also learn from the other wonderful panelists.
Awesome. Well, so happy to have all of you. I'm excited to dive right in, and we figured we could start with the big picture and really trying to frame why this moment matters so much in our baby's development. So the key question I'll start with is, what are the key developmental milestones that signal readiness for solids? And why is this transition such a big moment, both medically and nutritionally? Dr. Rajani, I'll start with you.
Yeah, I mean, I think, this is one of those things that there's a great deal of variation across the world. And that's why I'm really interested to talk to Erica and hear her thoughts, because, in different parts of the world, people start these things in different ways. Typically around 4 to 6 months is when people begin this transition, but as a high level of subjectivity, and quite honestly, I don't know that there's any huge hard and fast rules, but we really like to see babies be able to sit up with minimal head support, have good neck control, and have lost their tongue thrust reflex, and really be interested also in what other people around them are eating before we start this.
Yeah, Erica or Emily, guys, feel free to jump
I
in.
actually just want to throw something back at you while you're speaking here, which is that what I experience when I'm taking care of patients is parents feeling a little afraid to feed because of the gag reflex. So you just mentioned that tongue reflex that we're looking to develop. And then we have the gag reflex, which is positioned forward to prevent choking. But do you actually mind, as a doctor, just commenting on that to parents? Because I know that's a huge thing that we're up against in the feeding space, addressing.
Yeah, I mean, gagging is good because
I
that
know.
is actually
It makes
helping
sense.
to protect the lungs from food going there. So if you do see that, I think that's actually reassuring as opposed to how we would normally
Right.
see it in an adult. And this is something that does require some time. The feeding and eating solids is a form of practice. It requires this coordination to be developed, and we see that in the premature babies that I look after every day. Is that this is going on in a different way with feeding, and Emily is intimately familiar with that too. So yeah, that's a wonderful point and definitely something worth bringing up.
I can say, as the non-medical person on this panel, I'm more on, the food side and development of food and things of that nature. I've always been told and advised, that gagging is good, as you just said. It means it means it's coming out. It's not, they're not choking. And so I think it's important just in general to, if there is anxiety around that, and I say this as an extremely well therapied person with a lot of neuroses and anxiety, try not to relay that anxiety to the kids, to the baby, right? Like just stay calm. They are reflective of your own sort of emotions and mental state. So, don't freak out. If that does happen, it is very natural, and, let them get it out the natural way, and just try to stay calm and not let them absorb that energy. But
Yeah, I can say from firsthand, even yesterday, that's
Mhm.
easier said than done.
I
Oftentimes,
know.
my
I know.
6-month-old son was having some broccoli and got red and was then started to gag on it. And I know that I've been told that that is a good thing. That means he's learning how to gag, but luckily he was able to get it out properly. But it's scary. So I rushed over. My wife was there, so it's certainly scary, but it's good and reassuring to know that that's them learning how to do things, and the gag reflex is one of those things that they need to learn because it's important, clearly.
Yes.
Anything else to add on this specific topic, guys? Which is just kind of high level. It's just why is it such a big moment? Both medically and nutritional. Anything to add before we move on?
I just want to jump in really quick and just say that in terms of like signs of readiness or seeing things like gagging and wondering, is that normal? Are they ready? Um, for me and from my experience with parents is really finding the sweet spot in the time that it feels good for you and your family, right? I feel like, and I saw my pediatrician around 4 months for my girls. We talked about introducing solids. I didn't really feel that ready myself. It felt like a lot of an undertaking at the time because I was working and I was pumping and I was breastfeeding, and introducing meals felt overwhelming in conjunction with most of my kids really weren't ready until like 6 months. And I sort of felt this pressure that they should be ready sooner because we had talked about it at 4 months, and then they weren't really that interested at 4 or 5. And all this to say, I think I just want people to know that looking at your child's signs of readiness is obviously very important, and leaning into when you're ready to, because it is a bit of an undertaking, and knowing that your baby will get there, right? There's a lot of pressure in the feeding space, and it doesn't stop actually with starting solids outside of breastfeeding and pumping. So just like finding that sweet spot for your family and knowing that you're all going to get there, however you want to get there.
Yeah, I mean, I guess that's a good follow-up question I have, which is there a too early or a too late, really? And we talked about some of the signs that babies are ready, but is there a such thing as too early or too late? And obviously those can be very distinct, perhaps.
I was just going to anecdotally say something, Emily, in response to what you just said. I didn't feed my first kid solids by like an extra few weeks because I wanted to get back to my parents' house. I wanted to visit my parents and have them be there for it. So what I've learned is, so I wasn't hurting my child by doing that. They were still eating their formula. I had formula fed babies because I couldn't breastfeed. But my point is, like, it is important that you feel that readiness, and that anything before 1, and please, from a medical perspective, like add on to this, my advice from my pediatrician and everything that I've read is food is great before one, but the milk is still the main form of nutrition, whether it's formula or breast milk, and that it's more for the children to experience food versus actually needing it for nutrition. But I'm going to let you respond to that. But just know that if you don't do it at exactly 6 months and you wait 3 weeks like I did, so my mom could, ooh and on wonder of my kid eating food, like we need to be a little less hard on ourselves with that kind of stuff.
Yeah, no, I mean, I think that, there's a great deal of variability. One of the things that I've learned a lot about with kids is that they're incredibly resilient. And I think there is a lot of variability that they can withstand and tolerate, so there's so many mechanisms in place. So certainly I think that, formula still or breast milk is very important. And these are things that are coming in slowly. And that transition, can be tenuous for some kids, depending on how picky they are and socially how much they want to fit in or do what people around them are doing. And this is where really, having good data to be able to track what's going on with their growth can be extremely important. Of course, the vast majority of these kids are going to do very well and are going to find those calories. But being able to continually monitor weight, as solids are introduced, and also look at their response, look at their stools. Are they loose? Are there other issues? These are all things that can be tracked, and things like tools like Woddle are helpful in that regard as that transition is going on. So.
Awesome.
I mean,
Well,
you want to just too early, too late? I feel like just to comment on that question there, and I think you could probably speak to this too, Dr. Rajani, but when I think about too early or too late, and I do think we should talk about this because we do see parents introducing sometimes too early when we're thinking about like sleep and the baby that is still feeding at night or getting up at night for food. So there can be like pressure from parents to maybe feel like they should introduce solids because they think it'll help their baby sleep. And when I think about too early, I am thinking about head and neck and muscle coordination, a baby that has the ability to sit with minimal support at the waist and really be engaged and keep that head and neck support throughout the feed. So when I think about too early, I think about, if they're not ready and it is too early, we're not going to have that good head and neck control and that interest. I'm interested to know if anyone else wants to comment on the too late. When I think about too late, I more so, and Erica, this might be your lane with the picky eating, is just that like, part of this process in the 6 to 12 months, especially, is textures and temperatures and tastes and exposures. And like, it can take your baby up to 15 exposures to really know if they like a food. And so when I think about too late, nothing's ever too late, but could we have more struggles, right, with a child learning to use their tongue and chewing and swallowing, especially when we get into those finger foods. So I think we're looking for that balance here. And I think both Erica and Dr. Rajani can probably elaborate on this response, but I do want to just like directly answer that question, Adam.
And I'll tag on to that if that's okay, Adam.
Yeah.
So kids, again, I'm always going to revert back to the medical professionals, but kids have what's called a flavor window. So it's between, there's varied opinions on it, but between 6 and 12, 6 and 14 months of age. And that is a time period when they're more, we can influence the way they eat a little bit more. They're more willing to accept kind of what we're offering them. And so to go along with what you were saying, Emily, different textures, different flavors, different spices. I always say it's not about parents get a little concerned when you say spice, but I'm not saying spicy. I'm saying spices. You make a sweet potato, right? You don't have to puree it, right? You can mash it and still give those pieces of texture. Sprinkle a little cinnamon on it. Sprinkle a little nutmeg. Like, give them exposure to some of these flavors so that when they finally do eat, the food, or what we hope they eat the food that we're eating and not just, chicken nuggets and things like that, they're not surprised by it anymore. Even one of our meals even has cayenne in it. And it's the very last ingredient on our bean bowl. But the fact is that cayenne comes back to them in a year or 6 months or 4 months or whatever. It's no longer a surprise on their palate, but it's not spicy. It's not burning their mouth in any way, shape, or form, but it is giving them that kind of early exposure. So we always talk about making sure to take advantage of that flavor window.
Eric, I think that's a perfect transition to the next topic I have is really just talking about those first bites and how to keep them low stress. How do you guide parents through that first or those initial food journeys?
Are you asking me or is that posed to the group?
I was starting with you, Erica, just because you were,
Oh,
yeah, I was starting with you.
so how to avoid, sorry, can you ask it again? Like it not to be a stressful environment? Is that what you were saying?
Basically, just how are you guiding parents through that first food journey, or how
Oh.
would you recommend parents explore that first food journey?
Well, it's kind of, what I said at the beginning too, even about the gagging, try not to have this be a stressful experience. We want the kids to absorb that good energy and know that this is a fun experience for them. It's their first introduction to foods. I always say, like, if you're really worried about mess, put a towel on the floor, whatever you want to do, put a bib on, it doesn't matter. But go ahead and I would say, don't be afraid of giving your kids food that doesn't come out of a pouch or come out of even a jar like ours, mash things, try things, break them up into little pieces. Don't be fearful of letting them try what it is that you're eating. Of course, there are healthy and safe sizes that they should be eating, right? And there's safe textures to be eating. What I've been advised is that baby food should be somewhat of if you're going to use the baby-led weaning tactic, that food should be cooked to sort of like a tofu sort of texture consistency. Dr. Rajani or Emily, if you have any thoughts on that. And then a certain size so it doesn't pose a choking hazard. So as long as you have those things covered and you're not giving your kid honey, which any pediatrician is going to tell you, grapes and things that pose choking hazards. Like it shouldn't be scary. And it is, I understand. With my first kid, I was terribly scared. And that's why I think he turned into a very picky eater because I did just give him mushy purees with no flavor. So with my daughter, I took total opposite approach. I'm like, I'm not going to have another picky eater again. And so I gave her coconut curry as her first food. And I'm like, she should be fine, right? But that was a second time mom's perspective. So, it is going to be different for you the first time around versus the second or third or fifth. But just know that no matter how you do it, you're doing it right. You do it the way you feel comfortable and the way and take your baby's cues. If they push something away, it may not just because they don't like the flavor, maybe because the texture bothers them, it's off, whatever, try something new. Emily said 15 times. It takes a long time to get a kid, exposed and accepting of something.
I come at it from a logistical standpoint. People come to me and they're like, how should I do this? And when should I do this? And not when in terms of are they ready? Like literally when. Like I'm breastfeeding or I'm pumping, I'm formula feeding, I'm bottle feeding. Like when do I feed my baby? So those are my two big things in the terms of how. There's so much pressure in this parenting space to do what's best for your baby. So parents are like, should I do puree? Should I do baby-led weaning? Like, which one is best? How should I feed my baby? And I think, and I'm sure everybody can agree here, like if you actually look at the research, one is not superior to the other. So like you really just need to feed your baby what's best for you and your family. And it could be a little bit of both. But I, as an IBCLC and like in this space, I get into the logistics of like, when do you literally want to feed your baby, right? If we're looking at when you're breastfeeding or when you're offering bottles and when you're pumping, how can we slide in like dinner for a little bit? And then maybe we work in a breakfast and then a lunch and working them up to those 3 meals. And we can all agree once your baby is between 9 and 12 months, it just feels like you're feeding them all the time because then they like snacks. So you're like breastfeeding or bottle feeding and giving them 3 meals a day and snacks. And you just feel like you're, making food or cooking or feeding a child all the time. But
which never ends, Emily. That
right?
never ends. I have a 6 and a 9-year-old. I'm always feeding them.
Then they become a toddler and they don't want anything that you make anyway, so then you revert back. But anyway, that's sort of how I like, those are my two big things that I am talking to parents about.
I think I can comment just a little bit on some of the more medical aspects. I think, Erica and Emily have got incredible street cred on from their past experience and from all the research that they've done. And I'll stick to some of the medical topics, which are, as Erica rightly mentioned, honeys and should really be avoided in the first year because of the risk of botulism. So that's the first. I think that's about as immutable as gravity. So I think that's an easy one that I feel comfortable talking about. The second I would say is really should continue to try and minimize cow's milk as a main drink. So I think that's an important one that maybe parents might start to think, well, if we're giving them other foods, why not that? Stay away from that as much as possible. Can be in foods, but maybe not as a main drink. I'd also steer away from any potential choking hazards, which again was already mentioned, which is perfect. Whole grapes were mentioned, other things, nuts, popcorn, raw carrots, they're kind of hard. I would stay away from those things. And then the last two things that I would mention that I think have come more into the forefront recently as we become more sensitive about nutrition is to really try and stay away from high sodium, heavily processed foods. I think are probably a bad idea, and really a lot of added sugar. As we talk about their palate and their flavor window, as Erica talked about, we should really be encouraging this next generation to stay away from those things as much as possible. Let's not get them attuned to a lot of these artificial things. Let's stick to a lot of these more natural sorts of things, or natural types of flavors. Eric is talking about nutmeg and I mean, fantastic stuff to help them understand and be able to appreciate. So we recommend, I do recommend to patients starting with some purees. Obviously it's nice if they're tasty. Iron-rich foods like pureed meats, beans, cereals, I love those things. Carrots and squash I think are great. Avocado, applesauce, those things tend to be nice. Of course, applesauce without added sugar, that is. So a couple of things that I like to start with.
I think we had a question come in into the message board as well about fruits specifically, and that she finds that most pouches are sweet, and perhaps maybe that's added sugar at times. I'm not sure exactly, but the question is, so what about fruits?
I wanted to say something following Dr. Rajani as well. When you said added sugars, which great follow on with the question. A lot of these pouches, if you really think about how much pureed fruit goes into them, even if it's natural sugars, it's a lot of sugar, and most of them do lean sweet. So, be very careful of even the natural sugars that are in these things. Also, like from our research, over 70% of kids who have a pouch have more than one at a time. So now they're consuming even more of these natural sugars. So if you want to give your kid fruit, my advice, and again, reverting back to the medical experts, is to give them the full fruit. Of course, cut into the right size pieces and all of that, but the fiber is in the fruit. It's not, it's not there once you mash it down into juice or puree or whatever. So give them the full fruit, let them have that fiber. It teaches them how to chew, right? It gives them their, the cues that they might be full, right? Whereas the pouches, you drink it, and so you don't get cues that you're full. So you keep going and going and going. So that would be my advice, do the whole fruit. You don't need to, press it into juice or anything or a pouch, and go from there. But now I pass it along.
I couldn't agree more. One of the things that's come up more and more in this past decade has been diabetes. And most of us think about diabetes and our aunties and uncles or grandparents. Diabetes is a pediatric disease, and it does start in this way. This is the insidious way that it starts. But interestingly, and obviously this is a very fun, exciting, and positive thing. So I don't want to change the tone, but fiber really affects the way that sugar is taken up by our body and really helps to mitigate a lot of the spiking that we see, which is really important. And these are the sorts of habits and things that start at this very formative time. So yeah, I do agree with Erica there. That's a good advice.
Thank you. Thanks, Doc.
You know what you're talking about.
Oh.
And then we had another timely question, I think, in the chat as well, guys. And Lee says, as a mom that had gestational diabetes during pregnancy, should I worry about the fruit I'm giving my baby, even if his sugar levels were normal when he was born?
Yeah, so I can take that one. And that's a wonderful question, and something that really demonstrates how much you're thinking about that. And what we do know is that babies who are born to mothers who have diabetes do have a higher risk of developing diabetes themselves. So, but to feed a baby fruit is not going to be the cause of that for certain. So, I think in thinking about natural and healthy foods, and fruit is definitely one of them in its natural raw form is really great. So I think there's no issue there, and I think that's wonderful that you're thinking about that.
Awesome. Well, let's pivot a little bit, Emily, to a little bit about what you were talking about, is logistics. And feeding, as you mentioned, is a juggling act. And parents are trying to approach combo feeding in the beginning, I'm sure, and timing meals with breast milk or formula or, whatever they're able to do. So what are strategies that you're recommending for that kind of combo approach and some of the logistics in the early stages?
Yeah, I mean, I really help parents craft a schedule that makes sense for them. So sometimes if you print a schedule or read something online and you think that's what you should be doing or that would be best, it's not going to be helpful if it doesn't make sense for you based on your daycare drop off or your work day. I see this right away with pumping. As an IBCLC, you might be told, make sure you pump 3 times during your workday at the 3 times that your baby is eating. But if you go to a job where that's actually not realistic and you can't do that, we're just setting you up for failure. So it's sort of like, well, what can you do when you're at work? And let's back into that. I feel like that's the same thing for feeding your baby. I want to take pressure off as much as possible, and that like you really can't mess it up, right? Like how do we find the way that's going to make sense for your family? I do like baby steps with parents when it comes to starting solids, and we'll kind of map out when they are breastfeeding or offering bottles, and then we'll look at the day and say, when would be a good time that you could sit your baby in the high chair for half an hour and practice feeding them? Because we all know the first 2 to 4 weeks is a mess, and they don't take in much always right away. Some do, but many of them are like just making a mess, and it's all this preparation and work and they're like, um, so usually that might be like an early dinner, right? Especially for my working parents who get up and get out the door and finally they come home. Maybe they'll do like an early dinner around 4:30, 5 or 5:30, and then they'll still breastfeed or bottle feed before bed. And then once baby is getting really loving food, we can put a breakfast in the morning or a lunch. I really lean into caregivers and providers to help in this space too. And so if my parents are utilizing a daycare, we can start sending food to daycare and asking those providers like, hey, it's really tough for us to get out the door in the morning and breastfeed or bottle feed and do a breakfast. Like we don't have time to fit it all in. So I'll say, let them feed them when you get to daycare, right? Or, at daycare, they're around other kids who are eating. So then they're curious and they're watching their peers do it. Or a family or caregivers are coming in the door, like how can we connect them and educate them in this space to support you? Because it is quite the undertaking. And then I think my final thing is you don't have to follow the perfect schedule. I see this all the time in the sleep space where it's like your baby should eat, play, sleep, eat, play, sleep. And not every baby will do that. Some babies get up and they play and then they eat and then they sleep. Or they eat, they play, they eat and they sleep, right? So we're looking for, what will work for your family and like just taking the pressure down, I would say.
My favorite is when they fall asleep while they're eating.
They do. That's okay.
Like you're living the life, guys. You really are.
I don't fix anything that's not broken. So if your baby falls asleep while they're eating and they go to bed and sleep through the night, leave it alone, right? Like,
yes.
I think
Yeah,
this is
anything to add? Yep.
I think this is where we have a great deal. New technology is actually quite helpful. Is that before many parents would just worry endlessly, and access to some basic means of measuring growth were not available unless you went to a hospital or you went to a doctor's office. But now there are lots of ways to chronicle and check how much your baby is taking in. Emily was talking about as a person who I deeply admire as an IBCLC, helping mothers with breastfeeding and hopefully with exclusive breastfeeding. Woddle has a great deal of utility. So we have a lot of mothers, especially that I take care of here in the neonatal ICU, where they're like, Dr. Rajani, we're not sure how much milk, my baby's getting. I just went home. I take care of a lot of normal newborns too. And so, being able to do pre and post weights, weigh your baby, feed them, weigh them again, can be really helpful in understanding how much they're taking. And many times I'm able to allay the fears of these mothers and get them to not supplement their baby with formula, and then this is another epic around 6 months where as this transition is going on, I see Jennifer's asking this question, how do I know if my baby is eating enough while we move away from milk? Well, the other thing you can always do if you're concerned is check their weight, and follow that. You can look and see, and that will tell you how they're doing and whether they're moving in the right direction. So I think there is some anxiety that can come in as this transition goes on. Well, they didn't eat anything. Well, they might be okay, you know, and you can know pretty quickly just by doing that. So I think that's something that's important for people to know, that our access to data and the ability to harness that to make good decisions is available at home. This doesn't need to happen just at your doctor's office or with your friendly local nurse practitioner or other provider. Yeah.
I try to teach patients like other things, like if you're breastfeeding, feel your breast before they latch, feel it after. Does it feel softer? Can you hear swallowing while they're eating? Are they peeing? Are they pooping? Every time you see your pediatrician, are they gaining weight? Are they meeting their developmental milestones? Like there's so many things that you can look at to feel reassured as a parent, especially when you don't know exactly how much they're taking in at any given time if you're breastfeeding, right? Unless you did a pre and post feed weight at every feed, which I wouldn't actually recommend doing, because you don't need to, right? And babies are really good self-regulators. They get really good at breastfeeding. They get really good at taking their bottle. They are really good at eating. And you will start to see, especially when you hit that year mark and beyond, that they will eat when they're hungry. Like truly, and they'll stop when they're full. Like they're very good self-regulators. And so I am just layering on like other things that you can think about in your brain too to reassure yourself, because I know it feels like tricky when you have kids and you're feeding them and it's new and it's different and you want to make sure they're getting enough. That's the big thing, right?
So I was just going to say something that's kind of follow Emily. It's about breastfeeding and wondering, if they're getting enough. And so for me personally, like I said, it wasn't working. It just did not work. Right. So, but there wasn't really a way to figure out why or, what I could do for it, or was it working? I just didn't know, And so I think there's so much pressure on us. So I guess my advice would just be kind of listen to your body, listen to your gut. If you feel like something's not working, call a person like you, call someone, call your doctor, like if it doesn't work, it doesn't work. We got to get your baby fed in a different way. So let's just make sure, that we're listening to our own body's cues and, and just doing what is absolutely best for the baby, which is eating. Hopefully, yes, breast milk, hopefully it is that. But if it's not, don't pressure yourself so hard that it's, you're feeling guilty in some way. I think that's a real concern for a lot of moms. And it was for me. And I moved past it with baby number 2 because it also didn't work then. And instead of like crying myself to sleep at night and doing all of that, I just said, my body, for whatever reason, isn't made for this. And so I'm just going to do the second best option that I have. And I took that pressure off me the second time. Again, I think we learn from child 1 to child 2, whatever. But yeah, it's just important to listen to our own body's cues too.
You always have options, right? Like breastfeeding is great, formula is great. You can combo feed, like it doesn't have to be one or the other. There's so much pressure. And so I fully hear you on that. I mean, I do this for a living, and my third was exclusively formula fed. She had severe allergies, and
Right.
I wasn't eliminating things from my diet. That was my choice. So, but there is so much pressure, and we have to shut out the outside noise and say, like, what's actually right for you and your family? And then we'll back into a plan.
Yep, I agree.
Well, Emily, you mentioned allergies a moment ago, and also someone did in the chat, and I think it's a nice transition to something that we should talk about, which is, what are like some of the red flags versus completely normal behavior when babies are exploring new textures, new flavors, new foods. Obviously, the things, of course, we're looking out for, of course, are choking and allergic reactions. But, what are the red flags versus what are completely normal behaviors that should be expected and perhaps even welcomed?
I feel like I threw people for a curveball by saying my daughter's allergies. To be clear, I'm thinking the babies in the first 6 months, the allergies and sensitivities, we had a cow's milk protein intolerance, which we know through research, most babies outgrow those around 6 months of age and beyond. And my daughter did outgrow that. It wasn't like a true allergy, which Dr. Rajani, I'm sure you can comment on those, and like allergic reaction when we are introducing solids. But I can happily support those who are breastfeeding or pumping, who are navigating intolerances, sensitivities, blood in the stool, separately. So, but we can stick with allergies for starting solids.
Okay, sounds good.
So, I mean, many people, have the past experience and typical recommendation has been that we space out foods by a few days in case there is an allergy. And how allergies present can be quite variable. They can be as simple as some vomiting, maybe loose stools, again, things that all can be tracked, with various apps and certain tools that we have, including Waddles. And those could go all the way to very severe reactions, which can include swelling in the throat, which can lead to difficulty with breathing, and in between maybe some sorts of rashes like hives, which are medically called urticaria. So there's this whole gamut of possibilities, what you can see. And Emily, again, astutely pointed out, the most common offender is cow's milk. So this protein within cow's milk, which is called casein, is not something that our guts as babies are really meant to be exposed to, right? We're drinking calf milk, right? When we're drinking cow's milk. And that does cause some level of irritation that can be quite variable. So where I work here, I do see some babies who can have some blood in their stool, as Emily mentioned. Sometimes that takes a couple weeks to happen because the immune system, which is responding to this, what it thinks is a foreign thing, it takes some time to wake up, and that creates some irritation in the lining of the intestine that can lead to some blood in the stool. So, but there are some others to watch out for. Those include eggs, peanuts, tree nuts, soy, wheat, fish can, and even shellfish. Those are the most common, but by and large, cow's milk and soy and eggs are major early offenders. So we tend to want to space those things out and be just cognizant of what's been introduced so that you can trace back to that. And sometimes it may take more than one exposure for a baby to have some sort of reaction that could be well within that range that I mentioned.
And from a mom's perspective, I knew early on through my pediatrician and my own research, I wanted to introduce my kids to allergens right away. There's a ton of studies. I encourage you to look at them, especially as a new mom feeding a baby or a new dad for the first time. Of introduction of peanuts through the LEAP program, or the LEAP study, I should say, and how that introduction was. There were the prevalence of food allergies in the kids that had the peanuts was far less than the ones that didn't have exposure to peanuts early. The American Academy of Pediatrics had come out with feeding guidelines saying we want to avoid peanuts. And then, well, we all know the prevalence of peanut allergies here. So then the AAP actually rescinded that recommendation and now recommends early and often allergen introduction. And please, Dr. Rajani, chime in if anything I'm saying is not correct. But we also work, with my baby food company, with Globowl, we work with a lot of doctors as well, and we take all that feedback into account. But kids around the world don't suffer from food allergies the way that we do here in the United States. And they're also not buying like sanitized, pureed pouches to feed their kids. They are feeding their kids the cultural food that they eat, right? Whether it's sesame and soy, or let's say sesame in hummus, or tahini, which is made of sesame and hummus, or whatever, it's peanuts in a pad thai dish, whatever, coconut is no longer considered one, but coconut in curries and things of that nature. These kids are exposed to that from the very beginning, and they're not picky eating kids with food allergies. So we're just trying to kind of, with Globowl, we're trying to change that because of all the science, because of all the medicine behind early allergen introduction. But again, if you have concerns, I saw someone in the chat say that their child has eczema. Dr. Rajani, please add to this for sure. But I was told that if you, exhibit eczema signs, that you could be more prone to have food allergies, and in which case, talk to your pediatrician, do what you feel is comfortable. And with that, I'm going to pass it to Dr. Rajani to add anything to that. But I think it's important that early and often introduction to hopefully reduce the likelihood of food allergies down the line.
Yeah. So what Erica mentions is true. So just because these things are at risk, it doesn't mean you don't give them, but just need to take note of what's going on. And to answer Lisa Farr asked this question about her baby. And so, yeah, any baby that has eczema, we talk about this thing called the allergic march or atopic march, where there can be the further development. Eczema can precede food allergies and asthma in some cases, or even allergies like allergic rhinitis, where there can be itching of the nose and so on. And babies like these are at a slightly higher risk of having food allergies, and some of the common triggers are the ones we mentioned. Milk, eggs, and peanuts tend to be the three most common that are associated with kids who have eczema. So to answer that question specifically, but I agree with what you're saying, Erica. I think that's very reasonable. We do talk about this thing in pediatrics, and Emily, I'm sure, is very familiar with this too, called the hygiene hypothesis. And that is that things are so clean where we are. Everybody cleans everything compulsively, almost too much. And this affects our immune system. There's this pathway called the Th1 or Th2 pathway. And because of how clean everything is, our immune system becomes hyper programmed to have allergy, really. And that's a gross simplification of immunology, but essentially we are sort of setting ourselves up. And that's why in many, other countries where people don't have the means to clean things as much as we do, they're not worse off for it. Their kids maybe have less of these sorts of things that we have in these very urbanized settings in first world countries.
Yeah, and I just used the word sanitized, right? It's like not only is it sanitized, cleaning and all of that, but our food has been sanitized, really. And when I first fed Charlie, my son, I was more afraid. It's weird. I really wanted those allergens in there because I know so many people who have kids with food allergies, right? It's a real problem. So I was actually more afraid of the texture and the spice than I was the allergens, which makes really no sense in my head intellectually, but emotionally, that's how I felt. I wasn't afraid of that because my pediatrician was so adamant about it, and from my own research. So, talk to your pediatrician, obviously, but know that is what the American Academy of Pediatrics recommends. So it is important. And the USDA and the American Academy of Asthma, Allergy, and Immunology, they all recommend it. But yeah. And Dr. Rajani.
That was great. I think that was extremely helpful on allergens, guys. And then thanks also for looking at the chat and taking a lot of questions. I think that is awesome. I'm glad we're able to answer the questions of the folks that are here. I am going to go to another topic, which is another, kind of hot one, which is weaning. And when and how do you know it's time to begin weaning? And also, like, just for parents from an emotional perspective, how can they feel good about whatever path they choose to take with weaning? So Emily, maybe I'll start with you there if you're comfortable.
Totally. The time to wean is when you are ready to wean, truly. And is gonna really vary. I just shared with you all that I weaned for my third, who was struggling with feeding, and we did that at 6 weeks postpartum, which was unexpected and not my plan. Obviously, if you are breastfeeding or pumping or combo feeding using some breast milk, I want to support women as long as you would like to be supported. And when you're feeling like you're ready to wrap up your journey, you get to wrap up your journey when you're ready. That might be when you're back at work and it's becoming unsustainable. That might be at a year mark. That might be beyond a year. I have lots of patients who extend breastfeeding. When I think about weaning and sort of breastfeeding in bottles, one of the biggest things that we do at NAPS is supporting parents around that 1 year transition mark, because so much changes. And so if you are still breastfeeding and it's going well, keep breastfeeding, go for it. You can extend breastfeeding. But the 1 year marker is this big change, because between like 12 and 18 months is when we help parents to move away from formula and bottles. And their baby is eating table foods now, which is a really big change. And they might be having a cup they have their water cup, and maybe they like cow's milk. Maybe they don't like cow's milk, right? Maybe they eat yogurt and cheese and get things in their diet. But I feel like the big thing for weaning at that 1 year mark, I'm working with parents who are like trying to get rid of bottles, essentially. When it comes to breastfeeding or pumping, I essentially, when I have a mom who knows that they're ready, even when they're ready, and they're like, this is a good decision for me, there's always these layers of like a little sadness and guilt, right? Because it's the end of something big. It's the end of like this journey, right? And so we're not going to squash those feelings. We're going to feel the feels, and then we're going to make a plan that feels good. And it usually looks like, it's very dependent upon your supply and how often you're breastfeeding or pumping, but I gradually pull back. I'll reduce sessions, but 5 to 4 times a day, or 4 to 3, or we'll taper sessions down by time and volume to slow the body down, to help the body like figure out where we're headed, and to manage the hormonal journey that comes with weaning. And then sometimes I have women who need to wrap up their journey faster due to a medical reason or a surgery or something not going well for mom, and then we move a little bit quicker. So there's a lot of different scenarios, but to be very clear, we will wean and support you like when you're ready to do that. And that is very variant based on doing this for almost 15 years now of so many different moms and their journeys.
Nothing to add to that. That's
Yeah, that's what I was gonna say. I think that was a very comprehensive
Yeah.
and fantastic overview. So
Oh, thanks, friends. Trying to give you the quick and dirty weaning talk there, but you know, I do think it's important to map out you, your supply, and what you're up to, because if I can do it gradually with you, that really does help your hormones and your body to slow down so that you're not, you know, uncomfortable in the process, for sure.
Got it. I think that also transitions nicely just to like feeding philosophies as well. And obviously baby-led weaning being one of them, versus traditional purees and versus combo feeding and everything in between. And we've touched upon this, I think, at various points, but how can parents choose a style that works for their baby and for their family? And maybe Erica, I'll start with you.
Sure. I can't sit here and say there's a right or wrong way of doing it. So, you know, if you are sitting there while breastfeeding or at late at night doing your research and you're, you know, reading everything you can about baby-led weaning and that feels the right path for you, just do it safely, right? Take the recommendations for the size of the food, take the recommendations for the texture. I think I mentioned like a firm tofu or more of a soft tofu, I guess. But there is no wrong way. My belief, like I gave my first kid, all those mushy purees with no flavor. And I told you anecdotally what happened to him. I mean, he does think chicken nuggets is its own food group. So I now have my daughter who eats everything. And I did baby-led weaning with her, maybe to an extreme with that coconut curry as the first food. But, I wanted her to be the exact opposite of what I had experienced with my son, especially because of the love of food in my family, and culturally, that's a big part of our lives. So, do what you feel comfortable with, make sure it's safe sizing, pay attention to your baby's your baby's cues. Like with Globowl, we chose to have chunky food, because I've talked to in my, in the time leading up to developing this product and while developing it, talking to occupational therapists and speech therapists and pediatric nutritionists. And there's a lot of issues with texture aversions as kids grow up. And so there are philosophies that early introduction to texture can help maybe stave off those texture aversions. It's not as well studied as, say, allergens, but I do think, having those texture aversions, my son, it was last night, I gave him corn for the very first time, and the texture of like that kind of like not film, but the what's left on the corn after you chew it, that little bit of skin, really, really bothered him. And I'm like, oh my God, my kid has this like aversion to this thing that he's never had. Maybe if I gave it to him earlier, it would have been fine, right? So anyway, that all being said, I'm of the mentality that, give your kids the texture, give them the flavor, give them the spice, give them the allergens, and hopefully it sets them up for much better eating, less texture aversions and all of that. And I'm not changing the subject, but I did see a question in the chat about overeating or overfeeding. And I just want to go back to that one thing about drinking food instead of chewing food. I think that also is a big component of texture aversions later on. You're consistently given drinkable purees. That's how you're going to learn how to eat or chew. And that's going to be your expectation, not to mention you don't get those cues that you're full. So overeating could happen, and generally does happen, and can continue later on. So there's just a whole slew of things to think about, but don't worry too much about it. The baby's fine. You're going to be fine. Definitely, I think that early introduction does help them enjoy some of these things like texture and flavor and all of that later on.
yeah, I think, again, Erica, great points. Chewing eventually over time is important, right? To satiety. So that's a good thing. And yeah, drinking your food is probably not great. So, but Catherine had asked a question in the chat about when to introduce water and other liquids. And I think that might be, from a pediatric standpoint, a good one for us to talk a little bit about, which is recommend maybe just small amounts of what we call free water after about 6 months, not to give too much early on. And, that can progress over time, maybe to about 4 to 8 ounces a day by 12 months or so. And, I just encourage everyone to be really careful with fruit juice. So, again, back to my preoccupation as a pediatrician with sugar, and, we really try and limit that to 4 ounces tops. So because of the concern about tooth decay and this excessive sugar. So my sister is a pediatric dentist, so I hear about this
Right, you
on
do.
a daily basis. So I'll just warn everybody out there about the ills of fruit juice in that regard. Obviously, hydration is important, and again, this is where monitoring intake and output when you're looking at diapers, and this can help a little bit about that. And Emily made mention of that. Because is very important and key. So water is something that we need to teach people is the best drink. So good for you.
Interestingly enough, my kids' preschool, unbeknownst to me, and great preschool, couldn't be happier, but they gave fruit juice during the day. And when I found that out, I told them, I don't want my kids to have the fruit juice. Please give them their water bottle, right? So like take kind of, you have autonomy, like you get to make that choice. Ask your school if they do lunches, or they do prepared foods for your kids, or they give juice. Feel free to speak your mind and say, I don't want my kid to have juice. They were very familiar with that. When I told them that, they're like, great, thank you. We'll put you on the list. So, just make sure you advocate for yourself and your child the way that you want to, and know that there's generally options.
Awesome. Well, guys, we're just about at time here, and I think we've covered a lot of the huge topics that are in this space, and I know that because again, I'm listening along with the rest of the crew here and taking notes, and we'll definitely make sure that my wife watches the recording, which we will send out for everyone here, to make sure that you can share it with your friends or watch it again if you'd like, just to go through it again. But first and foremost, I just want to thank all three of our panelists today. You guys are all wonderful. Thank you again for being here and being partners with Auggie. And I'm also very proud of all of us that we got through all of the questions in the chat as they came in. So I do think we've checked all those boxes, which is great. And thanks for everyone who also just attended and listened today. So yeah, thanks to everyone, and I hope everyone has a great rest of their day.